And I just want to say a quick thank you to Pearson for inviting me to talk today and allowing me to share some of my thoughts around this as well. You're going to see I've stolen some of their data and their findings to present in this presentation a little bit. So I'm going to say an advance thank you for that as well. So I'm going to be talking about teleassessment, which for many of you, if you've been tracking teleassessment, if you've been doing teleassessment, you're probably sick of hearing me talk about it. So I apologize ahead of time. But I'm going to be talking specifically around equity issues related to access, because I know this is a big issue, especially when we think about the world, hopefully soon at some point getting back to slightly more normal, and thinking about what this means, what we've learned during the pandemic, and what it means for potentially moving forward with teleassessment or going back to business as usual with in-person traditional standardized assessment procedures. Access is a big issue and is one of the main reasons I got into the research around teleassessment to begin with. So the problem, what is the problem that we're trying to address right now with teleassessment, but also thinking back a little bit? There are kids who need mental health services, right? There are a whole bunch of kids. And when we think about how many kids need mental health services versus how many are identified as needing mental health services, the numbers are pretty shocking. The numbers are around a quarter, maybe a little less than a quarter. The research has shown that we're identifying maybe a fourth of those kids who need mental health services broadly. When it comes to academic services, learning, attention, school-based types of services, we're doing a little bit better, maybe because teachers have their eyes on kids way more and care a lot more about this stuff. I don't know, I probably shouldn't say that. But in general, the research shows that we're identifying around half, maybe a little less than half of the kids who need learning and attentional and other educational supports. So we're doing a pretty poor job in general across the country. I'm speaking here, these are US numbers. This is not a problem that goes away if we broaden our scope globally. But these numbers do happen to be US numbers. And this is primarily why I got into the business of teleassessment to begin with. Long before the pandemic, I started doing research in this area because there were a lot of kids who weren't getting assessed, who weren't being identified for their learning, attentional, other needs that needed to be met. Now, this is probably not going to be a surprise. It is a sad statistic. But when we think about children of color, what do you think happens to these proportions? Exactly what you would expect. They go way down, right? Our disparities between those who need mental health and psychoeducational services and those who are identified as such for children of color are much lower. And when you add in the pandemic, we actually don't even know, right? We don't really have data about who's being identified, who has been identified over the past year and a half, how many were missing over the past year and a half. We don't have those rates. I hope somebody's looking at that. I'm not looking at that, but I hope somebody is researching that, because we're not doing a great job of identifying kids who have needs, identifying specifically what those needs are, recommending specific interventions, remediations, accommodations, and then doing it, conducting all of that work, intervening the way we need to, accommodating the way we need to. We are just missing too many kids. I'm going to focus on kids today, but there are patterns amongst adults as well. Certainly, many adults are not identified. Adults of color certainly are not identified at similar rates, right? They just don't have the same resources to be accurately, adequately identified for their needs, and then given a direction of how to intervene. This is a problem. This is a huge problem in our society. Our problem is one of access. It's not that we are hiding ourselves away. It's not that we're trying not to identify kids. I work with so many school psychologists, other psychologists who work within schools and in collaboration with schools. And all of us, and this is not just psychologists, this is all mental health professionals within school systems, have the best intentions. We want to identify the kids who are in need. We want to provide them resources. We want to provide them accommodations when we can, when we have the flexibility and freedom to do so. But we're overwhelmed. We aren't able to identify everybody. We're not able to certainly assess everybody who needs assessing. Some kids just don't have access to the services that they need. This is a pervasive problem throughout the US and throughout the world. Some kids just don't have access to mental health services, to mental health evaluation services, certainly to psychological and psychoeducational assessments, neuropsychological assessments. Kids just don't have access to them. And although if we think about kids in the public school system being entitled to evaluations, right? Legally entitled to evaluations, they may get some cursory evaluations within schools. They may not even. They may barely be making it through and meeting their educational standards. And so schools who are overtaxed may decide they are not in enough need to require the services that take a lot of time, that take a lot of resources. So this is a problem everywhere. And it is rife with structural inequities. It is not an equal opportunity offender. It does not affect every population the same way. Those kids who have parents who have more means, who have more maybe mental health capital, maybe they are more aware of mental health issues, of educational issues, have access to evaluations at a much, much higher rate than those who are in under-resourced schools, under-resourced neighborhoods, maybe have communities that are have lower mental health awareness or educational awareness, or who have parents who are overwhelmed and overtaxed themselves and cannot be helicopter parents, right? They can't be on top of their kids 24/7 because they need to make a living. They need to put food on the table. This is, again, a national and global issue that those with more means, those with more money, those with more resources have better access to these services than those without resources. We know that especially in, I'm now going to sort of turn our attention mostly to the US, but rural areas are seen to have pretty poor access in general, right? There are fewer mental health professionals in rural areas because they're rural. They're further away. So kids in these areas tend to have less access. And then there are some suburban areas and a lot of urban areas that are just overtaxed, that are overwhelmed. The psychologists in these areas cannot meet the needs of all of the kids that are, I'm going to put in air quotes, assigned to them, right? They are responsible for a large group of kids and they don't have the time, energy, resources to serve all of them. So we know rural areas have problems. We know there are certain pockets of very, very overtaxed suburban and urban areas. And the issue of resources and the issue of race and ethnicity are, as we all know, conflated in our country. So children of color tend to be in more under-resourced schools. They tend to be in schools that don't have as many resources, as much access. So in general, children of color are having less access to comprehensive evaluations, certainly, but even cursory evaluations that happen within school settings, they just have less access. If we think about, if I think about the New York City public schools, my daughter is in a New York City public school, and I look at the IEP teams, the mental health professionals within her school, and they are way overtaxed, right? There are thousands of kids within a single school, within this single urban school, high minority school, a lot of minoritized kids in this school, and a single school psychologist that is supposed to be providing the evaluations for everybody who has a need within this school. And you know, they do as good a job as they can do in this very, very limited resource environment. Specifically, there is a shortage of school psychologists and psychologists who work within schools in rural areas. Under-resourced schools in general, and especially ones in rural areas, have a tough time attracting psychologists to work with them. What that means is that I, as a psychologist in New York City, may be asked to go do an evaluation a 3.5-hour drive away up in the Catskills, or I may be asked to drive 4 hours, do an evaluation, drive 4 hours back. That's 8 hours of driving where I could be servicing other kids. I could be doing evaluations with many other kids who need it, but it takes a lot more resources to reach these kids within rural areas unless you have a school psychologist or a psychologist there to do those evaluations and enough psychologists nearby to be able to accomplish that. We also know that rural schools often don't have their own mental health team. They often share a mental health team amongst several rural areas in closer, again, air quote, close proximity. So it becomes sort of a logistical nightmare to be able to access these kids in these rural schools at certain points. School psychologists typically work at more than twice NASP recommended capacity. NASP recommends one school psychologist to about 400 kids. The latest numbers that I saw were on the national average. A school psychologist is working one psychologist to about 1,400 kids. So that's actually more than 3 times the capacity. And if you think about the fact that that's an average, a mean, that means that there are some cushy places where they're maybe working at 1 to 400 or 1 to 500. And then there are some other places where they may be working at 1 to 2,000 kids, one psychologist to 2,500 kids. But on average, they're working well beyond what NASP recommends in terms of capacity. So we need to redistribute resources. I put an asterisk here because redistributing resources is one way to minimally address this problem. The real fix would be to triple our resources, right? It would be to get a lot more money for schools, especially under-resourced ones, especially the overtaxed urban and suburban ones and the under-resourced rural ones, to get a lot more money, to get a lot more psychologists in those schools to meet those needs. That would be the best case scenario. I know that there's some legislation right now that we've been advocating for. I've been working with APA to advocate for some of this legislation that incentivizes mental health professionals to work in under-resourced schools. It's specific legislation that would offer tuition remission and student loan forgiveness for those who dedicate themselves to work for at least 5 years in specifically identified under-resourced schools. That's great. We need to bring more resources to these schools. But realistically, we're not going to triple our workforce. We're not going to be able to get 3 times as many school psychologists in schools nationally that would be necessary to meet the needs of these kids. So another sort of slightly more creative way is to think about redistributing resources. And this is why I started looking at teleassessment to begin with in 2015 or 2016, was thinking about those 8 hours I would have to spend driving upstate to do an evaluation. Wouldn't it be great if I could zap myself in over the internet and do a lot or all of this work remotely and think about all the time that I would save on that commute. We could redistribute some of those. It's going to sound funny. I know that there are those psychologists out there who are not overwhelmed. I don't know who they are. I don't talk to many of them who are like, yeah, I'm bored as a psychologist, especially school psychologists. Like, yeah, I just don't have enough students to work with. But they're out there. There are certainly ones who are not as overwhelmed and overtaxed as those who are working in these sort of under-resourced, higher need, and very, very overwhelmed areas. So we need to think about, can teleassessment help us redistribute our resources, redistribute and dispatch our psychologists, we are the resources, to these areas where there's more need? Could we zap in a psychologist to an urban, very, very overwhelmed, high density school to help relieve the one, maybe two school psychologists who happen to work there? So let's think about teleassessment and what some of the pros are, how it can really address and fix some of these issues. First and foremost, automatically, we have a within-state redistribution of resources. We have the ability, for me, not that I'm not overwhelmed, but I can work. I am licensed in New York State, so I can redistribute my resources. I can redistribute my services anywhere in the state. Any part of the state, any corner of the state. If we think about, again, very, very far upstate New York, when it starts snowing, even that 4-hour commute becomes unrealistic. When it becomes, untenable for us to even dispatch in person, we have a way to get there if we can use teleassessment. We have a way to redistribute those resources. And with PsyPact, this is even more feasible. We can go across state lines for those states that participate in PsyPact. New York State is not one of those states, so I'm not lucky enough to be able to register and think about broadening my scope and bringing my services to other states, unfortunately. But for those lucky PsyPact states, and I know there are more and more happening every month or every few months, they can redistribute a little bit more liberally, which is fantastic. As long as assessments are valid, we can increase psychologist capacity significantly. This is increasing our own capacity by cutting down on commutes and cutting down on these sorts of things. But it's also increasing the capacity for our field to meet needs in some of these higher need areas. Now you'll notice that little asterisk, and that is super important. It is super important. A little finger with a string around it in the corner here, right? We need to know that our assessments are valid for it to be a pro, right? If they're invalid, then that's going to be a huge con, and we're not going to be able to redistribute good resources. We don't want to widely distribute bad resources and bad services. We want to make sure that it's valid. So I'm going to take a little detour just for some reminders about validity in teleassessment. First and foremost, we need to remember what test scores are. I'm going to talk about what I have started thinking about, the myth of precision in psychological testing, the myth of precision. What we measure in psychological assessment is one of three things. We measure abilities, functioning, or traits. We do all of them, but we're really looking at skills and abilities, and that's mostly what we're going to be talking about today, because that's a lot of our IQ tests. It's our academic achievement tests. Although we call them achievement, right? Real academic achievement is grades. Academic ability is when we do individual academic tests in a perfect environment, in a quiet one-on-one scenario. We see what you can do academically, not what you necessarily do in standardized tests in a room, or grades or class assignments where you have to be on top of turning them in and these sorts of things. Abilities also include executive functioning and other neuropsych constructs that we think about. These are abilities. Functioning has to do with your everyday life, the kid's everyday life. How are they functioning socially? How are they functioning in terms of symptoms? How are they functioning in terms of attention in their everyday life, in school? Not their ability, but their functioning. It becomes tough when we think about something like a Vineland. Vinelands are often worded as skills, but are really looking at functioning. It's asking not, can you tie your shoe, but do you tie your shoe, right? Because if I want to know, can you tie your shoe, I need to ask you to tie your shoe and watch you do it, right? I don't want to rely on a parent report of, can you do this? It's, do you tend to do this in everyday life? So we're thinking about functioning also as symptoms. Symptoms are functioning, or how you're doing now in your everyday life. And then traits, and traits are how we interact with the world in a way, and these patterns of interaction with the world that are relatively stable across context and across time. I'm not going to focus on traits so much, but thinking about abilities, functioning, and traits, these are underlying things that we cannot test directly, right? I'm not testing your weight where I can put you on a scale and see how much you weigh. There may be a little error in it because of instrumentation, but really I'm getting it. I can't take your blood and tell you how good you are in your working memory or executive functioning and get a really good idea. This is the myth of precision. We've gotten a little lazy in our field in assuming that our test scores are this, but they were never this. Our test developers and our test companies need to worry about precision. We need to let them worry about getting it as precise as possible and studying where that standard error of measurement is. But we need to know in clinical practice, they are not precise. They are typically this, right? That F and P, they're still reliable, still valid. I still see an F, I still see a P. Hopefully most of you do too. But they're a little fuzzy. They're a little less precise. Teleassessment may add some variables to make it a little less precise. It doesn't invalidate it. We have a lot of equivalence studies that shows this. It doesn't invalidate it, but it may be a little less precise as we're going. I hope you can't hear my dog snoring. Then we also need to remember what assessment is. Assessment is different than testing. Assessment is different than screening. Assessment has to do with pulling together data from multiple sources and methods to inform clinical decisions. So it might be interview data, observations, collateral interviews, right? Interviews with teachers, with parents, other miscellaneous data like records reviews or other sorts of things, and test data, right? Test data are in there. They are part of an assessment, a comprehensive assessment. And when we think about it, what assessment really is making clinical decisions being maybe a diagnosis, maybe qualified for accommodations or qualifications for interventions. All of these clinical decisions are informed by all of this stuff. And all of these have error. Obviously, this is oversimplified, right? So if we think about collateral data for a second, collateral data is very rarely one clean, beautiful yellow circle like it is here, right? We may have different reports from parents and teachers and different reports from one teacher than another, and it may be a mess, and we need to know how to reconcile that. That is why we're psychologists, right? That's what we train for. We train to understand the nuance of data, to look at it more holistically, to take a step back and look at all the data, including our test data, including collateral, observation, interview, everything. We are trained to situate that within an individual, a student's personal history, personal context, cultural context, and make our clinical decisions and our clinical recommendations based on all of that together, looking at our own internal algorithms to understand why we privilege some data over others and understanding all of that. This is our job. This is why it's not good enough to just report test data and make decisions on test data. We need to do the work of the psychologist. But even if we introduce a little bit more error into that test data circle, we are still aggregating it with all the other data we have and can still make good clinical decisions based on everything put together. This is a shameless plug, and I apologize, and I will be very transparent that Susie and I do get residuals, we get kickbacks or whatever. We do get some money if you buy this book, but we wrote this book specifically to help psychologists do valid and ethical assessments through teleassessment procedures. That was our goal from the beginning. How can we help professionals make sure their work is valid? So it includes decision-making, steps to make decisions around ethics, like should I be doing this in the first place? Other ethical issues. And then it also surveys and goes one by one through a whole, I'll say, buttload of tests, especially performance-based, though we do cover self-report, collateral report, we cover our bases. We cover as much as possible. And although Susie works for Pearson, we did not limit it to Pearson tests. We included all of the widely used tests and methods that we could find and think of. And we look at where the evidence is, where the validity is, and what tweaks are necessary. So we list by test what you need to do to alter your administration, to alter your interpretation, to think about what is valid, what is not, what is ethical, what is not. So although this is a shameless plug, I want to be clear, we wrote this book to really be a resource and be as helpful as possible to psychologists to make sure that what they're doing is ethical and valid. All right, enough of the shameless plug. So when we think about the pros, and again, I'm going to thank Susie Rayford for letting me steal some of these data from their internal surveys and work. I know she's presented on some of this, but I've stolen some of it to present in my own way. Please rate your agreement with this statement. So this went out to a bunch of people, about 500 psychologists responded. I plan to continue using teleassessment to administer performance-based tests after the pandemic is over. I wish we had an end date to this pandemic and it was a clean end, but the idea is who would continue this? And I was surprised by these findings. If we look at it, more than half agree that they're going to continue using teleassessment procedures for performance-based. And if you add in the yellow of unsure, right, we really only have a quarter who said that they're not. We're really looking at 58% of psychologists who say they're going to continue this. That must mean there's something good. There's something beneficial to teleassessment, that we're not just doing it out of necessity during the pandemic, but we've learned actually we can do this and we can do some good work, and we may continue some of it as we go. The follow-up question is to explain, why do you plan to continue to use teleassessment to administer performance-based tests? Why? And here were sort of the aggregated and themed responses, right? Efficiency and convenience, greater accessibility, mandated by the situation or employer. And this one confuses me a little bit. I don't know many employers who after the pandemic are going to say you have to do teleassessment, but if there are, there you go. It limits health risks. And I think that is a recognition that although the pandemic may lighten a bit, it doesn't mean that it will end in a definitive ending. And it's not alone. There are other health risks. There are people who are immunocompromised who under best circumstances have a tough time traveling to an office and sitting in a room with somebody for a long period of time, breathing their germs and spitting on each other. We'll do with some clients based on clinical judgment, examiner preference, or client and parent preference. This is the big one that I want to highlight here, is that it does improve accessibility, right? Clients, we can reach more clients, and there may be some clients who are homebound. There may be some clients who have very, very limited pockets of time. So they can hop on for a 45-minute session, but might not be able to travel and do an assessment session multiple times. There is just some greater accessibility if we can do this. If we can, ethically and validly get to them, then there is some greater accessibility. But now let's think about the other side, the cons of teleassessment, the issues that it actually brings up. For this, I'm going to start with the survey that I've stolen from Susie. So in this part of the survey, about 3,000 psychologists responded. So which statements describe you with regard to using teleassessment to administer performance-based tests? I just prefer face-to-face. Absolutely. Many of us, especially early on, just preferred face-to-face when we haven't done this much, right? I think when people were thinking about transitioning to Q Interactive, I bet most people would say, I prefer the traditional way that I already know how to do. It's more comfortable than using iPads. It's more comfortable than doing teleassessment. I'm concerned about client access to technology. Now, although this is one of the major reasons that was listed as a pro, right, accessibility, we can get to them, it does bring up this issue. What if our clients do not have access to adequate technology? This is 55%. This is a good number of people who shared this concern, and it is a valid concern. I'm concerned about client tech experience, right? If we start using really, really sophisticated and fancy tech tools that require the client to interface with them in complicated ways, this might be an issue. I would argue the more fancy and complicated we make our systems, the more user-friendly they should be from the client side, and hopefully from our side too. Such that as long as they can, get onto an email and click a link, then all they have to do is interact with us in a certain way on that link and whatever we're using, hopefully. But this is a valid concern. I'm concerned with my own competency. Fair, absolutely fair. Some colleagues and I, I'll give a shout out to Stephanie Taylor, who's fantastic, have come up with sort of recommended sequencing of training to think about if you're going to jump into teleassessment. Very, very briefly, we recommend first familiarizing yourself with the landscape, which means doing your own lit review, or we've made that easy for you in the Essentials book. We've done the lit review for you, especially chapter 1. We review all the research around it. Doing at least 2 specific trainings, webinars, one on higher level issues around the ethics and the research behind these sort of high level issues in teleassessment, and at least 1 training in the nuts and bolts. And then doing your work. So practicing from beginning to end, finding a colleague to do the workflow with from beginning to end, and then almost like a sort of a competency exam, letting somebody who's sort of knowledgeable about these things do one with you and give you feedback. And then we recommend consultation, getting consultation from somebody who's good at this and fully competent on at least your first case, your first teleassessment case, to make sure that administration, but then also interpretation and all that kind of stuff is aligned with the research literature. But we should be worried about our own competency. This one I just put in there because I think it's interesting. A lot of people just don't think that there are equivalency studies, and there are. I like the way this is worded. It's not that I don't think that they're good enough, or I don't trust them, or they haven't been replicated. It's just like, I don't think they're out there. They are, they're out there. I do want to call attention to these couple that I would have expected to be higher. The problematic home environment, I would have expected to be a much higher. And then rapport and lost observation. The fact that, our behavioral observations are limited to sort of the shoulders up, which I will argue comes with pros and cons, right? We do miss the fidgeting of the tapping toes or twiddling with thumbs and that kind of stuff. But we're also forced to scrutinize what's going on a client's face, a student's face, in a way that we could be distracted by the twiddling of thumbs. So these weren't huge concerns, but I'm going to argue they should be. So another part of the survey, the top 10 challenges in teleassessment. If we look at the black ones, these are about tech. right? These are about tech access very broadly. Like if they don't have consistent Wi-Fi, if they don't have consistent internet access, if they don't have updated programs, failure of technology, these sorts of things are an issue. They're a challenge. If we look at the white boxes, and we're really thinking about this uncontrolled client environment, right? If a client is at home, we lose some of the control that we have in the room with us when they're physically in there. And then there are some others peppered in there, the clear ones. So when we think about the major cons, the major setbacks in teleassessment, I'm going to frame these a particular way, right? Technology access is one, right? Our clients, our students need to have adequate devices, right? They have to have a device. In New York City, I know that this is different in many different areas, but in New York City, the New York City Department of Education at the beginning of the pandemic said, we're going to make sure every kid has a device. So every kid got an iPad or a MacBook or some other computer, a laptop of some sort, because they decided, the Department of Education decided, we're going to be teaching online for the foreseeable future. We need to make sure they have access. This helped a lot because it meant that we knew when we were doing these assessments with these families, they would at least have a device. They would have something that they could work on. But they also have to have consistent and reliable internet access. This again becomes really, really tough. The New York City Department of Education didn't really solve this problem as well. They made suggestions, and there were, I know at my daughter's public school, there was a program in a giant building where kids could go and they had really good Wi-Fi. They could bring their own device and they could be there all day. And that provided childcare, it provided internet access, it provided quiet, provided a lot of stuff. It was great, but this is not equal amongst schools in New York, and it's certainly not equal across the country. And if we think about especially rural areas that tend to have less reliable internet access, period, these issues replicate and perpetuate systemic inequities. When we require our students, our clients, to have a really snazzy updated device and really consistent and reliable internet access, when we require that to be able to do a valid assessment, then we are systematically discriminating against those who don't have these. We're saying, okay, I'm going to provide these services to those who have these privileges. And these are privileges. And I think that school systems certainly have done a heroic job over the last year and a half of trying to make sure that these systemic inequities are righted in certain ways by providing adequate devices, and in some places providing hotspots, providing other sorts of access to technology. But I think that we have a long way to go. We have a long way to go. And I will argue that this is especially true with adults. Adults don't have the Department of Education, the school boards, looking after them in the same way. So there are some adults who are in these areas where there's not great internet access, or who may just not have access to a device, and school systems aren't going to buy them for them. So we need to really consider the fact that we have not solved this, right? We have brought about more issues when it comes to technology access with teleassessment. It just doesn't solve our problems here. The other major issue is access to a quiet and private space. This is not something that we tend to think about a lot. If you remember in that survey, not very many people thought The private space was an issue. That surprises me, but I'm also biased because I'm in New York City, where everyone lives in a studio apartment with 3,000 other people, right? We're all on top of each other in New York City. Even those of us who are privileged are on top of each other. So when we're doing remote assessments, especially when we're direct to home, beaming into their homes, we need to make sure that they have access to a quiet space and a private space. And these are two separate issues, right? It needs to be free from distraction. This is important for all of our performance-based tests and for self-report tests, right? We don't want them constantly distracted because that introduces error in a way that pulls us further and further away from standardized procedure. Distractions, if I'm testing a kid and their sibling is sitting there poking them or taking their hand and like, why are you touching yourself? Why are you touching yourself? Why are you touching yourself? While I'm trying to administer digit span, it's gonna be a problem. That is systematic error that is going to affect my scores significantly. So it needs to be pretty free from distraction. But it also needs to be private. It needs to be free from listening ears. If I'm doing, this is not just for test security issues, though it does solve that as well, right? If somebody is sitting there listening to all the questions and answers on an IQ test, that's problematic. We certainly don't want them feeding answers if we're doing like a giftedness evaluation. We don't want a parent just off screen feeding them. But also, you know, kids get self-conscious. We want to try and replicate that one-on-one, hopefully somewhat non-judgmental space that we try to build in our own practice, right? When I think about standardized practice, I think about the way that Pearson and other companies, other test developers, have developed these tests to try and maximize the best possible circumstances, right? These kids are getting a quiet environment in a room free from distraction, relatively neutral room with a somewhat friendly person, somewhat non-judgmental person who's not scoffing at them, right? One-on-one attention. These are, you know, it's what makes them good tests for evaluating what your brain can do, your ability, because we're creating the best possible circumstances. So having a parent sitting there being like, every time they get a question wrong or take too long to respond or something like that, right? We just want to make sure that they are free from that, from those prying eyes and those listening ears, and that scrutiny that they may feel if there are others around when you're trying to get their best possible performance, their maximal performance. These also tend to replicate and perpetuate systemic inequities, right? We think about, I think about the kids that I'm testing in New York City, and so many of them, we just can't find a time where they're in their one-bedroom apartment or studio apartment, aren't gonna have other siblings jumping around, or, you know, families can't just like leave for a couple of hours and let me do my testing and just go wander the streets. Like, that's just not realistic. And this is a bigger problem in less resourced families. That's how it perpetuates that systemic inequity. We're again saying, we will do this for those families who can find that private space, private time, free from distractions. And this is a problem. So teleassessment is a solution to access, but it is intimately tied to privilege. It is intimately tied to privilege, because those who can do teleassessment may not be the population at the highest need. There are plenty of kids who are very, very high need of our evaluations who can absolutely meet our criteria of having a computer, having consistent internet, have a quiet space, private time. There are plenty of very, very high needs kids who meet those criteria, but there are many who don't. And these are the same kids who tend to have the worst access under best possible circumstances, right? They're kids in our most under-resourced schools. So we have a need for creative hybrid models. And I'm just going to talk for a minute about a model that we've piloted that I know is going on a lot of places, the sort of in-office remote assessment, but we do it a little bit differently. So in-office remote assessments are great. I consider them completely remote because you are never in a room in person with somebody. So it is remote, but you're remoting from one office to another. So you bring a family and you bring a kid in, and they're in one room using your device, your quiet space, your internet access, your freedom from distractions. They're using all of your stuff, right? So that sort of solves some of our problems around privilege, but you're remoting in from an office next door or down the hall. So it is safer, right? You're not sharing germs, you're not spitting on each other. And, you know, again, we need to be creative. If you're using some blocks or some pegs or something like that, they may need to shuffle them and you may need to add some instructions. That's okay, that's not the end of the world. However, this doesn't help us redistribute our resources, right? It doesn't help me go upstate. So some of the hybrid models and some that we've been piloting have to do with me remoting from my home or my office to a far away remote office situation. So my clinic, for example, is closed. Right now, we're doing all of our work still remotely, but we can have, which means we have rooms to use. So I can set up a room with a laptop, with document cameras, with materials, stimulus materials or response booklets, stuff like that, some pencils without erasers and everything I need. I can set them up, but I can zoom in from home. I can zoom in, zap in from another completely different area. I can set up one of these remote in-office, but fully remote situations in collaboration with a school that's far away, with a library that's far away, right? I can call a local library in somewhere upstate, in Niagara, upstate, and work with them to set up a room in a way that means they have a computer, consistent internet, maybe even some response booklets, and quiet space. It's a private room, and I can set it up so that I do my remote assessment in this way. So it's not just an in-office remote where I'm sitting in an office next door, but it helps us solve that redistribution as well, because I can still go far, far away within my state, because that's where I'm licensed. I can still go far away, but not fall prey to the problem of doubling down on privilege issues and inequities. So we have a need for more of this. I'm hopeful that researchers and clinicians will continue to evolve and develop more creative models that don't fall prey to reinforcing inequities, societal inequities, that have the they have the sort of possibility of solving some of our big problems by redistributing resources without privileging privilege, right? Without privileging those kids who have access to all of this fancy stuff that they need to be able to engage in our teleassessments in a valid and ethical way. All right, I'm going to open it up for some Q&A. First and foremost, though, I want to say thank you again to Pearson for having me and letting me ramble on about this issue. I also did include my email here. Please feel free to email me if you have questions, thoughts, concerns about teleassessment in general or anything else. Please feel free to email.
Hi, Jordan.
Hey, Susie.
Hey, there are some questions that we've been saving up for you, and most of them are in the Q&A box. We've answered some of them, but maybe we could just go through some of those. And then there's one that was in the chat that we are just going to ask you verbally.
Okay.
But there was a comment on the New York public school system that I guess that you were mentioning that they provided devices and they provided access. One person commented that they missed hundreds of children who needed devices, especially kids that were in the non-public schools. And that it sounds like their procedures left out a lot of kids. And then also there were concerns from this particular attendee that disabled and non-affluent people were discriminated against in those.
Absolutely, and I will add, I think it's more than hundreds. I think the New York Department of Education had the best of intentions to distribute these, but distribution, especially early on in the pandemic, was very difficult. I feel for them, but absolutely, I think lots of kids did not get access to devices, to the resources they need. And I agree. I don't think it was, I don't think it's random error. I think that there are certain pockets of kids, especially those with physical disabilities, maybe those in non-public schools, I'm not sure as much, but they were probably more likely not to get a device than others. So yeah, I was using it as an example with best of intentions and within a 1 hour webinar, and not to scrutinize the New York City Department of Education in any way.
Sure. I hope that there were learnings from that can be used if that's necessary again. There's another question that's along the same lines, and this has come up in some of our other talks on teleassessment. And I think you were getting at it at the end when you talked about how you have an office that's available that someone could go into. Along the lines of access to a quiet space or access to the technology that's needed in your travels as a speaker in this area, what creative ways have you heard of that people are solving this issue or addressing it? Like you talked about the flipped office where someone could go into your office. What else have you learned or what have you heard about how to solve that?
Yeah, so some people are getting creative financially as well. I think there are grants you can get. It depends where you work, what agency you work with, and that kind of stuff. But some places, we've been successful with this as well. If you can get a little bit of extra money, then you can find even more creative ways. Obviously, right? We can be more creative if we can have money. But we can rent laptops and rent hotspots and get them to clients if they do have a space but no technology access. We've gone so far as to get some gift certificates to restaurants for families to get them out of the house. And we let them go to a restaurant while I sit with their kid on Zoom, just to get, if they have a lot of siblings or to get them away. And you can look for grants, or you can build that into the cost of an assessment. Like there are different ways to do this. I would say the most promising and creative ways are collaborations. Like I was talking about with public libraries and things like this. If we can find good collaborations, good local collaborations, then we increase our resources. We increase our reach and are able to get kids the access to technology and to quiet spaces that they need to be able to do the evaluations.
Thank you. I also heard of one group that purchased some computers that people could take home. They could come and pick them up. And before we knew as much about COVID, about surfaces, they actually put them in a lockbox outside their office for someone to come pick up and take home, like the Chromebooks.
we have a couple of loaner laptops, and I just haven't been brave enough to send them with people. I want to see them again. So so I feel like we found that renting them is a little bit easier because they have to go to the rental place and sign it out and sign it back in themselves and that kind of stuff. But absolutely, if you have the bandwidth and the trust, I mean, I don't even send blocks out because they're too expensive to replace, let alone a laptop.
Mhm. Here's another question for you. This is from Catherine Vieira Baker. She says, I want to normalize that there are glitches that occur during in-person assessment that we have to take into account when considering the test scores for those who are concerned about the potential for increased error when using remote assessment. Do you have a comment on that?
Yeah, it goes back to my eye chart, right? It goes back to that myth of precision. The myth of precision not only applies to the fact that we are taking these scores as gospel about that one kid, but it also makes this weird assumption that we have given it in the most perfect way and nothing has ever gone wrong in the administration of a WISC ever. Like nothing has ever been problematic in the way that I give a WISC because I'm perfect. And Susie, you know better than most, we know that under best possible circumstances, people are making tons of errors in a WISC. Like that's part of, unfortunately, the test error. It's part of that it's kind of built in a little bit to the standard error of measurement, but we know glitches happen all the time. And some of them are negligible and some of them we assume are negligible, but may not be negligible, right? So we always should have been thinking about test scores in probably a fuzzier way than we tend to.
Mm-hmm. There's a comment from an anonymous attendee, and they asked for your thoughts. One of the problems is that in most states in the USA, school psychologists who do not have a doctorate cannot be licensed to work outside the school in that state. So while many of us are perfectly educated to do counseling and evaluations in schools, we cannot outside of schools. Mental health is failing and we can only work in the schools. This is an option that's not being considered. Do you have thoughts about that?
I just have lots of thoughts and I see that we have 1.5 minutes left. I think that this is a huge discussion. You are absolutely right that we are shooting ourselves in the foot. We are under-resourcing our world by limiting sort of weird scope in somewhat arbitrary ways. I think that working with a kid outside of school is not dramatically different than working with a kid inside school. I'm really privileged right now. I am the chair of the American Psychological Association's Board of Educational Affairs. And right now we are working on a bunch of initiatives around master's level training. We are working on master's level accreditation. So accreditation of master's level psychology programs in HSP and school clinical counseling. We are thinking through scope of practice for master's level clinicians broadly, which includes school, but also other master's level mental health care professionals, psychologists, specifically in psychology. And these conversations over the next, I would say, year to year and a half are vital. And I welcome those sorts of comments and those voices to make themselves heard in the conversations in APA around scope of practice at the master's level and accreditation and competency for those training at the master's level in psychology.
And how can they best do that, Jordan? How can they get that information to you?
APA, you know, their website is super user-friendly. It's not at all. Okay. You can always email me and I will point you in the right direction. There are different task forces that are being developed all the time that are all working in concert. We are also working on a one landing page, I think this is in the works, on the APA website around the master's level issue. So everything will hopefully be housed or linked out from that one page in the near future. So that's another place that you can look.
Okay, really quick, teleassessment in the forensic setting.
Teleassessment in forensic setting. Yeah, so some has been written about this. Plenty of teleassessment is being done in the forensic world, and plenty of forensic work is not contingent on testing, right? A lot of forensic work is interviews and records reviews and collaterals and stuff like that. So we need to not forget that. It hasn't been tested in court thoroughly. There is not a case I can point you to that has set a precedent to say this is going to be kicked out, this is going to be accepted. We just don't know. I know that a lot of forensic work, I do some of it in circumscribed areas, But I know a lot of judges are like, do what you can do right now. And, we just have to make do with what we can do. Post-pandemic, I don't know. I don't know what it's going to look like. I am very hopeful that research in teleassessment will proliferate after the pandemic is over. I'm hopeful that a lot of research groups will start replicating equivalency or looking at forensic realms, or, I am hopeful, but I know that's probably an unsatisfactory answer. It's sort of like we're not sure yet, but do your best.
Well, I
Thank you.
show, yes, sorry, I show that we have extended our time. I would like to thank our presenter, Dr. Wright, for sharing his expertise with us. And also thank you to our Pearson Q&A managers for a great job in the chat box, or the Q&A, I'm sorry. Thank you for your participation in our webinar. Please leave your browser open as an action item list will pop up. Look for your certificate in your email later this week. Have a wonderful rest of your day, and this does conclude our webinar.